Perfect. Well, it's right at 12 o'clock, so we can go ahead and get started here. Thank you all for everyone that decided to join on today in the middle of the day here. We have Dr. Elizabeth Shepard with us from the University of Tennessee, and she's going to kind of kick off our parasite pursuit kind of webinar that we're doing through the LSU AgCenter. And so a lot of great information I'm sure she's going to share with us, and along with the other presenters throughout the rest of the month leading on into March. So I'm really excited. Like I said, this is kind of a pilot webinar series. So we're still working out some kinks, obviously, and things like that. And technology is typically not always on my side. So I'm excited and I'm looking forward to it. And I'm looking forward to all the information that Dr. Shepard's going to share. So Dr. Shepard, if you want to take it away.
Awesome. Thanks, Tyler. Yeah, I really appreciate the opportunity to be here and you reaching out and setting this all up. So also, it's a privilege to be the first speaker in your webinar series. So this is also fun for me because it's not the typical type of talk that I'm used to giving. So it's nice to be on this side of things and talking about parasites. So like Tyler mentioned, I'm here at the University of Tennessee. My name is Elizabeth Shepard, and I'm an assistant professor here in immune physiology. I started this position about a year and a half ago, so I'm still kind of new, I would say. Sometimes I feel really new. But I'm just going to briefly give you my background and how I got here, essentially in doing what I'm doing, and then we'll talk about some parasites of small ruminants. Hopefully my presentation works. Okay, yeah, so I actually did not grow up in agriculture, so I feel like I have to admit that right away. But thinking about it and thinking about my family, my mom actually grew up on a dairy farm in West Virginia, and it was passed down through generations, and it ultimately went to my uncle. My uncle didn't want to do the dairy farming life anymore, so we actually traded that in for sheep. And so this is really my first taste of interacting with sheep is going to his farm, and he would give us a hands-on experience every time we went. I think my brother has helped with like AI sometimes, and so he would just toss us in and expect us to drive tractors and work with the animals. So I tend to blame him for all of this. But me, like I said, I didn't actually grow up in ag. This is me when I was a kid. I was just a kid that really liked being in the outdoors, and I still really love cats. So I grew up in Colorado. I grew up with the Rocky Mountains in my backyard. This is where you could find me outdoors doing outdoor stuff, but I had to pick something to do, and I had to go to undergrad. So I went to the University of Colorado in Boulder, and it was actually there that I think it was probably like my junior or senior year where I had to fill an elective. I had to pick a course, and what fit into my course schedule was a class that I didn't even know what it was about, but I picked it. I was like, sure, credit hours. And that ended up being a parasitology course. So like I said, I went in and I had no idea about parasites, and I left being blown away by parasites and just super fascinated by these host pathogen interactions and just complexity of the types of diseases that parasites could cause. So I knew that when I went to grad school, that's what I wanted to do. I wanted to study parasites. So I go back to blaming my uncle for some of this in his sheep farm. And so he still has a sheep farm today. He has over 250 head. But he got me in touch with who would become my advisor in graduate school, Dr. Scott Bowdridge at the University or West Virginia University. And so I packed my bags, moved from the Rocky Mountains to the mountain state of West Virginia to do my graduate work. So this is my lab when I started. And I always put these sheep here because these were the first sheep. And so as soon as I got there, I was tossed in with these animals. And these were our culture sheep. So we worked with Homunculus contortus, which we'll talk a bunch about today. But I was charged with taking care of the culture sheep. So that meant that we would infect these animals and give them an infection on purpose of Homunculus. And then I would have to collect their feces, their poop, regularly, so that way we could continue the culture of them, so we could work with them in the lab and infect other animals. And so these are some of my first sheep there, and I still love them. And this actually is a good picture of our raised floor barn that we used at the university. So this is a nice way to keep it clean. They don't have this anymore, but it was a nice way to keep parasites out at the time. So I was convinced that I was just going to move to West Virginia, do my master's degree, and move back to Colorado. But it was during that time that and finishing up my master's actually, that I was like, I don't want to stop doing this. I actually really like asking questions about this. I like the applied side of things, being able to work with these animals and seeing real results from the research that we were doing. So I decided to stay for my PhD. And so that's a picture of our farm that we spent many hours at in West Virginia, and then our lab and some of our sheep. So we worked with a bunch of different types of sheep in our research project. So after graduate school, I ended up moving to Tennessee. And so I moved right before COVID, like before we even knew that COVID was a thing. And so my husband had just gotten here at the University of Tennessee, and I had just graduated. So I moved from the mountain state to the Smoky Mountains. So you'll see a trend there. I really like mountains. But I feel very fortunate because I was able to do some postdoctoral work in different model organisms. And I actually squeaked in the door of these positions 3 days before COVID shut down the university. So I was very lucky to get these positions, or this position. And so during this time, I worked with dairy cattle. So this is me with a statue of a cow from one of the big dairy farms around here, Sweetwater Valley Farms. And then I also worked with chickens. So that was really fun. And this is me with one of our own chickens, because we have chickens. So not to go into the nitty gritty of all of that work across these different species, but I really appreciate these opportunities to be able to work with different species. So again, during graduate work, I worked primarily with Homunculus contortus and some of our sheep. Working with chicken, I really looked at adipose development and muscle physiology there. So that was really fun. And then in dairy cattle, that was a nice perspective in working with a different type of pathogen and working with mastitis. And so that was really fascinating. And then rumen microbes, I can't go into too much detail because I've only briefly worked with rumen microbes, but just looking at some of those bacterial communities and how that relates to feed deficiency in cattle. So I really enjoyed all of these different experiences, but this position became available here as a faculty member, which I was really eager to take to be able to continue doing that research. So my position right now is 85% research, so that's primarily what I do, and 15% teaching, so not as much. And I teach an animal immune physiology course. And so that's here in the Department of Animal Science. And really the focus of my research is ruminant enteric health. So that's pretty broad, but I'll talk about it a little bit at the end. And so my research really focuses on homunculus and understanding some of those host pathogen dynamics. So to get in really to the heart of what we're talking about today is understanding the problem. So I'm going to walk through a few of the key parasites that impact small ruminants, how they impact small ruminants, and then get into a little bit about anthelminthic resistance. And I think in future webinar series, you're going to talk about some of these management practices and stuff, so I'll only touch a little bit on that. So if you're not familiar with parasites, just simply parasites are an organism that either lives on a host or inside of a host. And so these can be very broadly worms. So we have roundworms and flukes like liver flukes, tapeworms, pinworms. Those are all parasitic worms. We also have protozoa, so single-celled organisms, as we talk about Giardia a lot. And we'll talk about coccidia, which is a protozoa. We can also have our mites, like ticks and fleas and other types of mites and leeches. Those are also considered parasites, but they live on the outside. So ectoparasites. But really what makes a parasite is that it gets all of its energy from the host. And I always think it's really interesting because when we think about these organisms, they haven't developed sensory organs. They don't have eyes typically, or pigments even, because they don't really need that to get through and survive. The host is providing energy, and the host is also providing protection from the environment. So that means that these parasites get to spend all their energy on reproduction. So they're very prolific and successful. Parasites are also ubiquitous. So pretty much, I would say everything has a parasite, can be parasitized. Even parasites can get parasites. The good news is parasites are often species specific. So we don't always see the same parasites that are able to infect, say, a chicken. They can't always infect another type of animal, but I say that with caution because sometimes we can see them cross over different species. But for the most part, they're species specific. So in grazing ruminants, they're going to be exposed to gastrointestinal parasites. So we're really going to focus on those gastrointestinal parasites. And so the ones that I have listed here, we have their scientific names, and they can infect like cattle and sheep and goats. And so the top ones there in the blue box, like Trichostrongylus, Strongyloides, Nematodirus, Esophagostomum, and Coccidia, I put those all together because those are going to really inhabit the intestines, the small and large intestines. So each of these parasites has their own tissue niche of where those adults are going to live in the host. Whereas if you look at the bottom in the orange brown box, worms like Homunculus contortus and Telodursagia, the barber pole worm and the brown stomach worm, we find those in the abomasum. So we'll talk a little bit more about some of the big ones here. But what's also interesting about these is that these helminths and coccidia, so the worms, they're going to actually invade some of the tissues. So they'll get inside of it and encyst in it. Whereas Homunculus is the only one that doesn't burrow into the tissues. And so we're going to talk about what that means here in a little bit. So of these, I think the three big ones in small ruminants, particularly in sheep and goats, that we see being a really big problem are the barber pole worm, which most people are probably familiar with in some capacity. And so these, like I said, mature, the adults mature in the abomasum. The pathology that we see with this is anemia, so it's a blood-feeding worm, and so that causes a lot of blood loss in these animals. Clinically, we see bottle jaw, so the body's way of making up for that loss of red blood cells is to try to compensate with increasing plasma and fluid, but that tends to fall out of the vasculature and really accumulate around the jaw because these animals have their heads down feeding. And that anemia also causes lethargy, so I think that these are sometimes difficult to spot in animals. Coccidia is another big one. I see this all the time in our sheep. It's just kind of something that we deal with. It's really hard to get rid of, even in our animals that are just housed in our barn. But coccidia is a protozoa, so that's one of the single-celled ones. And it's really problematic because it causes cysts or small inflammatory spots in the small and large intestine, depending on the species. And in really heavy infections, sometimes it can spread to the liver. But the clinical signs of this are diarrhea and intestinal damage, which can be problematic. So that also causes weight loss, and in severe cases, also anemia. And then the other one is tapeworm or Menesia. So if you've had the pleasure of seeing these, this was very common on our sheep that we would throw out on pasture. So these adults live in the intestines, and the pathology associated with tapeworms is generally intestinal blockages. So at low levels, if you don't have a whole lot, it's probably not a lot to worry about. But some of the clinical signs can be diarrhea and weight loss if you have a really high worm burden. So I put this up here so we can talk a little bit about the life cycle of each of these. So hopefully it's not too overwhelming. But really, this is to look at the oral fecal transmission, right? So all of these are spread through feces out in the environment, and those are getting picked up by the host again. So they all have that in common. So I do want to point out some of the similarities and differences in these without getting too far into the weeds and terminology. But so like I said, all of them are oral fecal, but the barber pole worm is very simple direct life cycle where we have the adults in the abomasum. The adults are sexually reproducing and passing eggs in the feces. Those eggs go out into the environment and they hatch and they molt into infective stage larvae, and then they're consumed again by other grazing sheep. So similarly, coccidia are protozoa there. The infective stage is out in the environment that gets consumed by the host, and then it goes on to reproduce and is shed again. So the tapeworm is a little bit different. It has to have an intermediate host. So the sheep is dropping feces into the environment, and so again, those eggs get ingested by mites this time. So it has to have an intermediate host before it can become infective. So instead of the sheep directly eating that parasite again, it's eating that mite that has been infected. So it's just a little bit different of a life cycle. So again, this is just that fecal transmission, and we're going to see how rapidly that can build up on a pasture in bedding too. So I really love this photo. This is a photo of the abomasum of a sheep that we had on study, and we opened it up, and all of these things that you can see are adult Homunculus contortus worms, and most of them are female. I don't really see too many males in there, but you can see clearly why they get their name, the barber pole worm. So the females, they're blood feeding, so their intestines are going to fill up with blood and turn red, and then their ovaries are actually wrapped around that, so it gives them that look. And you can also see good examples of the damage. So I said earlier that these are a little bit different than the other types of worms, that they don't actually get into the tissues themselves. But what Homunculus does is it pokes a hole in the abomasum. So you can see on all of those pink arrows is that it uses its little lancet. It pokes a hole in the abomasum and causes damage that way, but then it causes blood to flow freely in the abomasum, and that's what those worms are going to consume. So this can become really problematic. One adult worm can drink up to 0.05 mils of blood per day, which doesn't seem like a lot. But if we start doing some math and we figure that maybe we have an infection of 5,000 worms, that can be up to 250 milliliters of blood loss per day. So to put that in perspective, that's about a cup of coffee's worth of blood per day. And so if you have this type of infection over several days, that's a lot of blood loss. So that quickly leads to problems in animals with more severe infections. And on the other side of that, so those adult worms are sexually reproducing, and one female worm can lay over 15,000 eggs per day. So if you have 5,000 worms, or at least half of those are female, right? That's still millions of eggs being shed by one animal per day. So that can accumulate very quickly. So this is also another great picture just to illustrate the larvae that are out on grass. So these are the infective stage after the eggs hatch, and this is what the animal is consuming to get reinfected. So this is a very nice picture of Homunculus and what it looks like. And then in the bottom left are the eggs shed in feces. So we can also use fecal samples to get an idea of the level of infection. So we'll take those feces into the lab and then we can grind it up and we can count the number of eggs per gram of feces to get kind of an idea of the larval, the worm burden that that animal has. So that's an important diagnostic tool. And that's also involved in some of those anthelminthic drug resistance tests. So we talked a little bit about the pathology of these parasites, but it also has negative impacts on other aspects of the animal's health. So not only is it causing problems in either the intestines or in the abomasum and those types of pathology that we see with anemia, but that's going to have downstream effects on things like nutrition. So it's going to depress appetite of those animals. That also impairs gastric digestion if we have lost integrity of the intestines or the abomasum. And that also decreases the ability to use those nutrients being provided. So other studies have also looked at changes in reproduction or an association in reduced reproduction of animals that show animals with higher fecal egg counts, so a higher worm burden, tend to have lower body weights, and that also resulted in reduced maternal survival. So it has real consequences on some of these health outputs and survivability. So we can also look at some of the traits, some of those economically important traits. So wool quality, when we look at parasitized animals compared to control animals, see a 10% reduction in wool quality. Dairy goats, for example, we'll see a 22% reduction in milk yield and a 15% reduction in body weight gain. So there are real economic costs to these even outside of treating them. So that's really what we're working towards, is improving that. I put this up here because I think it's always good for me. I like seeing the different perspectives on things, but I put this up here because this shows the number of sheep per square kilometer, and albeit it's about 10 years old now, but I think I'm always surprised at the distribution of some of these things. Like Homunculus is really global. So this is the number of sheep, and then when we start looking across some of these regions, looking at Pakistan, Ethiopia, Switzerland, Italy, it is far-reaching. And so I think that these are in areas that, to me, represent completely different types of geographies, climates, and areas, and types of production systems. but all of them are still struggling with parasitism. So over 94% in Pakistan, 74% of sheep are parasitized in Ethiopia, Switzerland, Italy, and it's predominantly Homunculus contortus that we see. So it is a global problem, and it's also a problem that we're facing here in the southeastern United States. So what contributes to that? Because again, I think about it broadly, and you don't expect to see parasitism at that level across all of these different types of geographies, but climate really has a significant impact on helminth development. So tropics and subtropics, we think that larvae are present year-round due to those climate conditions. But in cooler, temperate, or arid, dry climates, the conditions for the larvae tend to be confined to warmer months or months with greater rainfall. So I think what we're seeing is expansion of those temperate regions, less harsh winters, and increased rainfall. So that means increased incident of Homunculus contortus, especially like moving north in areas that we wouldn't necessarily think that it would be. So Homunculus contortus itself thrives in temperate, humid climates. So I think of Knoxville. It's a big change from Colorado, where it's very dry most of the year and we don't get a lot of rainfall. And Knoxville is a very temperate, humid climate. So the larval stages require moisture. They don't like being dried out, and they like temperatures between 48 degrees and 82 degrees Fahrenheit for their development from eggs. So eggs themselves, so once they've been shed in the feces, they can persist for about 2 to 3 weeks, even in the absence of these conditions. So they have some sort of protection. They're trying to wait for those right conditions so they can get through drier spells or extremes in temperature and then hatch when conditions come back to normal or what they prefer. So the other thing is that in warmer temperatures, it actually takes less time for those eggs to develop. Usually when we bring those feces back into lab and develop them from eggs into larvae, it takes about 14 days just because room temperature is pretty slow for them. But when the weather warms up outside on pasture, that can be rapidly increased. Instead of taking a week to 2 weeks to develop, it can take maybe 3 days. So that also causes higher levels of infection just due to that warmer weather and what Homunculus really prefers. So like I said, they don't like being dehydrated. That definitely will kill them. And they don't really like extreme temperatures. But part of this is that they can withstand those winter conditions, just being protected from freezes by topsoil or bedding and things like that. So they do have their own survival in some of these extreme environments. So I know that Knoxville is a little bit different than Louisiana, but I pulled up Knoxville's climate graph. So this is the average temperature and precipitation in Knoxville. And just looking across here, so you have the average temperature on the left-hand side, and then the average rainfall on the right-hand side, and then the average highs and lows throughout the year. And as I was looking at this earlier, I was thinking to myself that most of the months out of the year, we have very suitable conditions for Homunculus to be sustained on our pastures, with the exception of maybe some dry months in September and October, and maybe some cooler weather in January and February. But it's even more variable, like the last few days here in Knoxville, right? We've had very warm weather. So I think this kind of speaks to its ability to persist, especially throughout the year in these regions. So I think, we talk about this a lot. We talk about increased resistance to all drug classes, and that's largely due to the overuse of anthelminthics and just routine deworming. So a lot of times this is just treating an entire flock when only maybe a few individuals are infected, because it becomes really difficult to pick out the individuals that need to be treated or selectively treated. And oftentimes, I'm probably guilty of this myself, is using the incorrect dosage. Sometimes we just wing it. We look at individuals and we assume this is how much they weigh and this will cover it. But what happens when we do that and give a dose that's too small or inaccurate is that it's exposing those worms that are in the animal to this drug and leaving a few behind. So that way that the worms can actually adapt to the drug. And so that builds up resistance to it. So we have a bunch of worms that now are resistant, and those are the ones that go on to reproduce, and those are the ones that get shed into the environment. And so that's kind of how we lead up to resistance. Another part of the problem is that we haven't discovered or invented any new anthelmintics since 1981 when ivermectin was introduced. It was a wonder drug back then, and we still use it now, but yeah, we have resistance against all drug classes. So really, that is the big question, right? There aren't very many treatment options available, and there aren't new drugs. It's really expensive to develop new drugs, and to deliver them is very laborious. So we continue just to work with what we have. And I think part of the problem too is just when we have a large number of animals, and some of these signs of homuncus are very subtle, right? Unless we're out there checking the match all the time and running them, it's difficult to identify individuals that are sick before it's too late. And we've seen that even in our own sheep. We had a ram that we turned out to pasture, and it wound up dead 7 days later, which was very quick. And what had happened when we opened it up is that its stomach was filled with homuncus, and it was just drained of all its blood everywhere else. So we had no idea until it was too late. So I want to point out that this is just one study, and there have been several surveys. I think the individuals that were doing these surveys, they haven't in a while. So this is the most recent one I could find was from 2008. But that kind of speaks to how persistent this problem has been, and it's been a problem for a while. But this study was looking at the prevalence of anthelmintic resistance on sheep and goat farms in the Southeast, so across a broad region of the Southeast United States, as well as looking at some of the Caribbean islands as well. So this study looked at 46 sheep flocks and 20 goat farms, and what they were looking at was the level of resistance. So they've got the homuncus from the animals, they got the feces from the animals, they hatched out the larvae, and then they determined the resistance to each of these drug classes. And I think they also did fecal egg count reduction tests to see which dewormers behave or perform the best in their flocks. But really, this is against those farms. So 98% of those farms showed resistance against benzimidazoles. 54%, so over half of them, were resistant to levamisole. 35% against ivermectin, and 11% to moxidectin. And so this is a big proportion of them that are showing resistance. And again, there are a number of surveys out there looking at different regions, and you'll find slightly different numbers, but the story really is all the same, that there is a high level of resistance against each of these drug classes, to the point where about 48% of those farms were resistant to all three of those drug classes, and then 17% were resistant to 3 classes plus moxidectin. So it's really a challenge. And so, like I said, I think that you guys are going to talk about this in some of your future webinar series, but some of the management strategies that we talk about in my lab are not treating all of the animals at the same time. So this helps maintain a population of worms that haven't been exposed to some of these dewormers. That maintains a population then that are drug susceptible. It also is using deworming with effective combinations, so using more than one type of dewormer and dewormers that have short-acting treatments. So I've kind of listed some of these over here, and they're common drug names, and the withdrawal period, which is a little bit different than the activity period of these drugs. But we typically use levamisole, but we're already starting to see resistance to that, so we're going to have to include another drug combination with our sheep here. And so something else is rotational grazing as a management strategy, but that requires giving 3 to 6 months for those larvae to die off the pasture. And it's also very labor intensive, especially in the studies that we did while I was in graduate school. It was a lot of work. So it's not always, super practical. So I think another thing that is becoming more popular, and at least my understanding after talking to Tyler is that some of these hair sheep are more popular in your region. Katahdins are very popular here in Tennessee. It's definitely a growing interest here in Tennessee. And this is actually different from further north in some of the more popular breeds like Dorsets and Suffolk up north, but they're having problems with homuncus as well. But anyways, using sheep with natural resistance to Homuncus contortus, I think, is becoming more popular. I also visited Scotland 2 or 3 years ago, and we're talking to sheep producers there. And so they have a huge sheep population, and I asked them about the prevalence of Homunculus contortus there, and I was very surprised. They were like, oh, we don't really have a problem with it because we use easy care sheep or hair sheep that they didn't have to shear and seem to be pretty resistant against Homunculus. So I was like, oh, okay. Not a big issue for them and not something that they were super concerned about. So the sheep that we use in my research are the St. Croix hair sheep, Caribbean breed, but Gulf Coast native sheep and Barbados or American black belly sheep also show a level of resistance to Homunculus contortus. Like I said, Catons are really popular, I think because of their carcass traits and also, they don't have wool, but they tend to show intermediate resistance. So we can have high fecal egg counts from those or low fecal egg counts. So that seems to be a wide variability in the phenotypes that we get there. And so this is to just show some of those differences that we see. So like I said, the model that we use in my research is looking at differences between our St. Croix. So we use those as our resistant sheep, and then looking at Suffolk sheep as highly susceptible sheep. And so what we see here, we are looking at that fecal egg count in that top graph, and we see a huge distinction there, right? So our Suffolk have high egg shed, whereas our St. Croix have very low and are able to resolve it within about 35 days after we give them an experimental infection. So this is showing us that there are some differences, some real physiologic differences here in these animals. And then the bottom graph is just looking at a worm count from the abomasum of these two different breeds. And we see that the Suffolk have high levels, and that corresponds with the fecal egg count data as well. And then we have the St. Croix that have very low abomasal worm counts. And that is suggesting to us that our resistant sheep don't even let that parasite establish. It just gets flushed out of the system before it can even start reproducing or shedding eggs in the feces. So a lot of the research done has shown that this immunity to Homunculus contortus is largely driven by this really robust immune response that these St. Croix sheep are able to produce against the larvae. So I put this up here because typically we think of inflammation as a response to pathogens. It's a very normal response, and it's actually a very good response. It's how we respond to things and kick it out of the body. So we kind of want that and expect that. Things that are associated with that inflammation are pain, warmth, swelling, and redness, and I'm sure we all have experienced that at some point in our life. But like I said, it's typically protective, and that's what we want. The thing about helminths, though, is that they have a different type of immune response or cause a different type of immune response. So these worms want to go unnoticed, right? They're a parasite and they need that host for protection. So they actually trigger something that dampens the immune response. It dampens inflammation, and it kind of drives the immune system in a different direction. It suppresses those types of response. So we have these two kind of contradicting types of immunity. And what's really interesting is that, again, these St. Croix have that strong immune response that are able to recognize that parasite and flush it out before establishing. So they drive what we call a weep and sweep response, where in these animals that are resistant, they somehow, the mechanism we don't know how, they recognize that parasite, but they increase mucus production in the gastrointestinal tract, and they're going to increase peristalsis of the gut to flush it out. So we know physiologically what's happening, but we don't know the mechanism of action behind it in these resistant animals. We also know that there are other factors that affect immunity. So immunity is really important in clearance of that parasite, but we know that pregnancy and lactation also have impacts on that immune response and ability to mount the appropriate type of immune response, whether to worms or bacteria or viruses or whatever. Just because there's such an energy tax later on in pregnancy. So we see this change about 3 weeks before lambing and that early lactation period up to 8 weeks after lambing. So this is when the ewes are usually a little bit immunocompromised, I would say. And then nutritional status has a really big impact on this, making sure that animals have adequate protein and weight gain. So we see huge differences in our St. Croix sheep and their growth rate compared to our Suffolk sheep that grow really big, really fast. So eventually, our Suffolk, over time, it's a lot harder to even experimentally infect them just because of the weight gain and also age. So other factors that can affect it are stress. So young animals are usually very susceptible, and weaning is a critical time period just because they haven't been able to build up their immune system yet. And transportation can also cause stress. So we see this, when animals, the cow-calf stalker transport, but also in sheep and goats that are being transported as well. And this might also expose them to other illnesses like respiratory viruses and bacteria. So like I said, we often have kind of conflicting types of immune responses that are really going to weaken it if they have some sort of virus or bacterial infection at the same time. And age. So immunity can develop over time with previous exposure. And we do see that eventually in our Suffolk and other breeds of sheep is that a little bit of exposure, as long as it's not too severe, is that we can build up a little bit of immunity that becomes protective over time. So these are just to kind of pose some questions, and what really shapes the research that I do in my lab is asking these questions, knowing that we have these two different types of immune responses to helminths. How is that modulating the ability of that animal to respond to other vaccinations? So how do our vaccines for bacterial diseases that we give our animals impact helminth establishment, and vice versa, really? So does the presence of having parasites reduce the ability of that vaccine to protect vulnerable animals? So these are some questions that we have, and these papers are just some of the literature that are out there in different models in ruminants like cattle, but also some other parasitic models that are used. And so really the goal is not to stop vaccinating or stop using dewormers, but how can we improve the efficacy of both of those by better understanding how the host and parasite are interacting? So I'm just going to leave on this last slide, not to go too far in the weeds, but again, what we do in our lab is asking what else we can learn about susceptibility of animals, what makes an animal susceptible, and what makes them resistant. And so we do this by looking at the immune system and the immune response and understanding how metabolism factors into driving these different immune responses. So again, we see huge, just with our eyes looking at our animals, different metabolic responses and growth rate of our two different breeds of sheep. So is that contributing to the different types of immune responses to our parasites? And so we're really trying to get an idea of what those immune systems look like between our two different breeds, and understanding how that immune system is communicating with the rest of the body. So that way, maybe we can drive our susceptible animals, if we can drive their immune systems towards something that looks more like resistance. And so I think that was my last slide. So if you guys have any questions, I'd be happy to hear from you all or hear about your experiences that you've had with any of these parasites. So please ask questions.
You should be able to type either in the chat or the question and A box above if y'all have anything.
All right. There's the chat. No questions?
You just did that great of a job.
Oh, sure.
No,
Yeah.
it really was great, though. I think there was a lot of great information shared and a lot of, I don't want to say baseline information, but I feel like a lot of information that people might often forget and is a good refresher to think about, especially moving forward into the rest of this webinar series that we're doing. With no questions being asked, I want to say thank you, Dr. Shepard, for coming on and giving this presentation to go ahead and kick us off. Like I mentioned earlier, it was really, really great. Hopefully by the first of the week of next week, I'll be able to have this linked on the sheep and goat section of the LSU AgCenter website. We recently just kind of redid that section of the livestock page. And so be sure to check it out and share it with your other producers and maybe people that you might think would be interested in this. This will also be up on the YouTube page, LSU AgCenter-livestock, for you to be able to rewatch, or other producers to come back and rewatch. Or our next webinar series will be Strategies for Control, Biological Methods, with Dr. Rocky Lemus, an extension and research professor from Mississippi State University, on Friday, February 21st at 12 o'clock. And so make sure to have plans to be there and attend for that. And so thank you again, Dr. Shepard. Thank you again, Dr. Edwards, for hopping on. And with that, we'll see y'all here in the next 2 weeks.
Thank you so much. I really appreciate it.
Absolutely.